Greetings, this is Gene Tyre welcoming you once again to the View from the Summit. Today we express our gratitude to Dr. Michael Gruber once again and to one of Dr. Gruber's patients, Mr. Arthur Owsley. Dr. Gruber, thank you for giving us the opportunity to visit with you in your office as you share with one of your patients a procedure that you're going to be performing on him very, very soon. And Mr. Owsley, thank you for giving us the opportunity to visit with you today. As we begin our program and before Dr. Gruber has an opportunity to share with you and our viewing audience some very important information concerning the procedure that he's going to be performing on you, how did you hear about Dr. Gruber?
I had a friend of mine that just had his right knee replaced, and he told me about him. That's why I went and found out about it.
Well, we are thankful that you found out about him. And Dr. Gruber, Mr. Owsley is looking forward to his surgery, and he's looking forward to a great improvement in his quality of life. So we'll let you share with our viewing audience and with Mr. Owsley some very important information that I'm sure is going to be very helpful to our viewing audience.
Well, Mr. Owsley's a little atypical as far as how long he went with his osteoarthritis. He has severe disease, and you'll see that on his walking that we evaluated. But he's had trouble for well over 15 years, I think. With
about 30 years.
30 years, yeah. So, so anyway, we're going to do a knee replacement. There's other options for arthritis that we do. There's injections and things, but he's certainly beyond that. And now we're at the point where we're talking about replacing the knee. And what do we do when we replace the knee? You know, a lot of people are under the impression that we put a hinge in there, that we just kind of cut above and below, remove the knee, put a hinge in. That's really not what we do. What we do is a resurfacing. And so this is a model. This is very similar to what you'll get. This is a thigh bone. This is a leg bone. And rather than putting a big hinge in, we're resurfacing the bone. So what we do, it's some small cuts. It is a little bit of carpentry, but we're removing very small amount of bone, about the thickness of this metal that we have. And then we replace that cut bone with this metal component that's made to fit to you, just like people have different size shoes. People have different femurs and different size implants. So this is press fit on the bone, and it's also held to the bone with a cement. It's the same stuff that Corian tabletops are made out of that's going to hold that in place. And then on the leg bone side, we have another metallic component. Again, it's a small cut on the top of the bone, and we put this metallic component in there, and then we have this plastic in between. And right now you've got bone on bone, and that hurts. There's nerve endings in that. That's why you hurt so badly. And what you're going to have is metal on plastic, and there's no nerve endings in that, and therefore no pain. There's also a little kneecap replacement that we do. We don't replace the whole kneecap, we just take the bottom surface off of it. And it's made of plastic, and it'll go up and down in this, on the end of your thigh bone. This will be going up and down, so that'll take care of any pain that you have from a wear on your kneecap. Now the other thing that we do, and we're going to be able to do in your case particularly, is straighten your knee. You know, you've worn out that inner side of your knee terribly on both of your knees. And this is going to allow us to straighten out your knee. So you'll have much better balance. Now the big improvement in knee replacements over the last 10 years or so has been this plastic. This plastic is so much better than it used to be. It's treated with radiation, and that bonds the molecules together. And so we used to tell people, just go as long as you possibly can, because the implants didn't necessarily last that long, but the implants that we have now we think are going to last 2 or 3 decades. So there's an excellent chance it's going to last your lifetime. You know, if you get 30 years out of it and you need another one, we can put another one in there on down the road. We're looking at his x-rays now, and this is his left knee, this is his right knee. And what really stands out in this picture is the absolute complete loss of joint space on this side. This is the inner side of his knee. You can see the bow that he has here. He's got a bow that goes something like this. Really what we should see is basically a straight line going this way, and you can see where his leg bone is displaced inward. You could just about put a basketball between his legs, at least a volleyball, I think, between his knees. But this outer side, this joint space right here, that's the cartilage on the end of the bone. He still has some joint space there, but as he's lost this and it's down bone on bone, it's actually like rubbing 2 rocks together. You've eroded one bone into the other. And as that happens, actually, there's a transition too. This leg bone is shifted over towards the outer side, the thigh bone shifted towards the inside. And you see that as well on this, on the right side, the same thing, down bone on bone. Just when you look at these bones, they're polished. They're just like if you had two rocks together and you rubbed them together so long that they actually polished the rock. That's what they look like on the inside. You see very large bone spurs on the lateral. This is the kneecap right here. He has some significant arthritis under his kneecap as well. This is looking at his other knee. These are tremendous bone spurs that form. And as the body tries to increase the surface area of that joint to try to hold this load that it's dealing with, you get these bone spurs. And the bone spurs aren't really necessarily painful in themselves, or they're just a manifestation of the arthritis. Do you have any questions about this?
No.
Mr. Owsley, let me ask you a question. How long have you been having this condition that has limited your quality of life?
About the last 20 years.
Dr. Gruber, why surgery now? I'm sure that there are those individuals who are considering knee replacement, and they've had limitations for a long time.
Right.
What determines for our patients that now is the time to do the procedure?
This is one of those operations where generally the patient tells me he's ready or she's ready. You know, that most people will go to the point where it's interfering with their lifestyle. They can't do what they want to do. They want to travel, they can't travel. It's awakening them at night. A lot of people, as they progress in their arthritis, will begin to have night pain, and they just can't sleep through the evening. And basically, it's the impact on their lifestyle when it gets so great that they just can't cope with it any longer. And you have to define that. That definition is different for a lot of people. You know, there's some people, you know, well, it's interfering with my ability to go work out, you know, and there's other people where it gets to the point where they can't get out of a chair and walk. And, you know, everybody's got a little bit different definition on how it's impacting their lifestyle.
I have another question for you, Dr. Gruber. I understand that you're going to be doing surgery on both knees.
Right.
Why are you going to do that in one one procedure?
You know, that's a debated topic in orthopedics, and having both knees done at the same time, no question, it's a much more difficult thing for the patient. The recovery is much more difficult. The rehabilitation is much more difficult. The upside is a few weeks later you're done. You're not going back. And particularly when you have two really bad knees, you know, if we fix one knee here, the other one's so terribly bowed, you're going to give that much more pressure on that knee for a while, and that would be a very difficult thing to go through. So there's a lot of things to consider. Now, if you have both knees done, most people need to go to an inpatient rehab facility. I think we've discussed that. And there's lots of different options here in Coweta County. There's the Noonan Hospital, Nursing and Rehab. There's several in Fayette County. There's Warm Springs, who does a great job. And really all these facilities do a good job. I've been very happy with all the rehab that they get. But if you have a single knee done, now most people are in the hospital 3 days and then they go home. And home health comes to their house for a couple weeks, helps them with their initial exercises and things, and then usually around 2 weeks they can transition. When they can jump in a car and go to rehab, they'll come someplace like Georgia Rehab at 2 weeks.
So when I noticed when Mr. Owsley came to the office a few moments ago, you were using a walker.
Yes.
And your goal as the surgeon is after the rehabilitation time, he will no longer use a walker. Is that correct? And his quality of life will be greatly improved.
That's correct. We hope to have you away from that walker fairly quickly. Now, people vary tremendously on how long it takes to do that. Now, you know, I had a little lady who's probably 70-ish, something like that, had bilateral knees. I saw her Friday. She's 3 weeks out, no walker, no cane, bending her knees 100 degrees. Now, she's one end of the spectrum. Now, some people take a month, 6 weeks to get away from their walker. Some people choose to use a cane for 3 or 4 months after the surgery, just mostly for balance and when they're in public, just to kind of fend people off and give them some security. So everybody's a little bit different on how long it takes to get rid of them, but eventually you should be free of everything.
Mr. Owsley, let me ask you a question. What are you really looking forward to when the surgery's over, the rehabilitation's over, and you're no longer on the walker?
donate that walker to Goodwill.
You got to donate the walker to Goodwill. Well, good luck. You have an outstanding surgeon that's going to be taking care of you, and Dr. Gruber, you have an outstanding patient here that I'm sure is going to follow all the advice that you give him, and we look forward to a tremendous positive outcome as a result of this surgery. And we will be following up with you after surgery. Do you have any questions before we conclude today?
No, sir.
Yeah.
But thank you once again
for
giving us your time, and thank you, Dr. Gruber, for allowing us to visit with us with you in your office. And we look forward to seeing you again here without the walker.
Yes, sir.
Greetings and welcome to The View from the Summit once again. Today our guest is Mr. Arthur Owsley. He was with us in the first part of our show, Dr. Michael Gruber of Georgia Bone & Joint. And today we're focusing on the post-operative experience of Mr. Owsley. Surgery is now over, and we're going to talk to Mr. Owsley, and we're going to talk to his surgeon, Dr. Gruber. This surgery had to have been tremendously successful because I've seen Mr. Owsley walk today. So Dr. Gruber, if you will, take some time and share with us about the surgical procedure, what you did during the procedure, and the results.
What we did was replace his knees, and I think we've been over that earlier, but basically it's a resurfacing. We take his knees, which have worn down to bone on bone, and we change that very painful bony surface into metal on plastic, which has no nerves and therefore no pain. And I just did the installation. He got the motor running. You said he was our patient. He's also our star. He's just fantastic. He's done a great job on getting these knees moving.
How long did the procedure take?
The surgery generally takes me 60 to 70 minutes. And then, of course, we did both of them, and there's a little fiddle factor in there. So altogether, 3 or 4 hours.
And then this was followed by physical therapy, and tell us about the physical therapy.
Well, therapy starts right away. Well, we give him the rest of the day off after surgery, but the next day we had him up going, and so he was out of bed, just trying to sit up in the bed and then take a few steps. Normally, for a single knee, you're in the hospital about 3 days, and by the time you're ready to go, you're walking with your walker independently. Much more difficult when you have both knees done.
And this was a procedure of both knees.
And this was both knees. We did them simultaneously. You can have a lot of people come in, they do them sequentially. They'll have one done and then have the other one done 3 months later. He wanted to get it all done one shot, and I think that was the best decision for him. And so he was in the hospital, I think, 3 or 4 days, and then went to Warm Springs as an inpatient. And it was, whereas if you have one knee, you can oftentimes go home if you have a good support structure at home. If you have 2 knees done, that's just not feasible, and you need an inpatient facility. And he did very, very well down in Warm Springs.
Dr. Gruber, after the surgical procedure, how long was it before he was standing?
You were standing before you left the hospital, weren't you? Yeah, so probably day 2, he was standing.
Mr. Arthur Owsley, you are the star patient of Dr. Michael Gruber, so we've seen you walk. Our viewing audience is going to have the opportunity of seeing you walk. Tell us about your experience.
When I woke up, I didn't even know he was through. I woke up and I was saying, well, when are we going to start? And they said, oh, you through. So.
Well, I saw you in the hospital, and you were having a little pain, and I assured you that it was going to be absolutely worth it. So all the post-surgical experience that you had in the hospital has certainly proved worthwhile, hasn't it?
Yes, sir, sure has.
Tell us some of the changes in your quality of life. What are some of the things that you're able to do now that you had a difficult time doing prior to surgery?
I'm doing some things that I hadn't done in 20 years.
20 years?
20 years.
Tell us about it.
Well, it's just, I get up in the morning, I don't hurt. I go do things I want to do. I walk out in the yard, do anything, I just don't have to worry about falling anymore.
Well, that's got to be a tremendous feeling, and so there's no pain when you walk?
No pain at all.
Dr. Gruber, tell us, as an orthopedic surgeon, I know you have many experiences that bring a lot of fulfillment to your life. But as you listen to a story like this, what's going on inside right now? Let us see the inside today of Dr. Michael Gruber.
Really, this is one of those operations we get really excited about. So it's so gratifying to see someone who is impaired by their arthritis and then being able to help them get back to doing what they want to do. Really, this is one of the most successful operations we do. In fact, this is one of the most successful operations if you look at outcome and actually quantitate outcome of all operations that are done across medicine, basically. So it's exciting for me because that's why I got in this, to help folks, and it's very obvious that we've been able to help him.
In the post-operative section of our program, tell us once again, what really motivated you to come to Dr. Gruber?
Well, I had friends that had his knees done, and he was having good success with his, so I just decided, well, if he's had that good success, I might as well try it too. So.
And I'm sure that you've had friends, you were mentioning to me earlier today about a relative of yours that has observed how great you're doing and is considering the possibility.
Yes, I got an aunt that's 82 years old. She wants him to do hers.
Well, that's what it's all about, isn't it? And so I guess when there's good health, Dr. Gruber, there's not much of an age factor, or is there?
That's really true. There's been some good studies done on folks in their 80s and even 90s, and if they're otherwise in good health, you know, generally they do very, very well, and it's very reasonable to consider surgery on them. If you've made 90 years old, there's a reason you've made it,
right.
And you're usually in pretty good health, and you can take things like that, and there's an excellent chance you're going to live another, you know, maybe even decade, and you might as well make that decade as good as you can possibly make it. So age does not preclude you from surgery.
What would be some of the symptoms that a person would be having that you would encourage them to come and have consultation with you concerning their knee?
Well, you know, it's pain. That's why most people come in.
Is it mostly about pain?
It's mostly pain. You know, there are some people that have mechanical problems with their knee, popping, clicking, giving way, and we see a good bit of that, but I think most people come in with pain. And really, it's pain that usually pushes people into finally having their knee replaced. When they're having, you know, pain that's present for most of the day, they have pain at night that may waken them from sleep. Now, there's very different grades of how people react to pain. You know, there's some people that a little bit of pain, they just don't handle it very well. He's a good example of people that can handle a lot of pain, and his knees were terribly deformed before he decided he was ready to have something done. So we don't, you know, a lot of people come in, they want me to look at the x-ray, tell them if they need a knee replacement. That's just not the way it's done. Really, they tell me if they need a knee replacement. Obviously, we look for the correlative findings on the x-ray and everything, but people come in and they tell us when they have enough dysfunction and enough pain to want to have this done.
I'm sure that Dr. Gruber is your star physician, and Dr. Gruber has declared today that you are his star patient, and the relationship that you have is very evident, the trust relationship between doctor and physician. How important is that in the healing process?
Well, I think it's important to have confidence in the procedure and what you're doing. You can see that in people if they have a very positive attitude and they have confidence in what has been done and that they can get it moving, then they generally do very well.
You mentioned something that I think is very, very significant. The people that I've worked with, people that I've talked with about that mental attitude, and Mr. Arthur Owsley has had that positive attitude that I'm going to get this done. I'm not going to live with these limitations. This is going to be successful, and whatever I have to do to improve the quality of my life, that is what I'm going to do.
That's why he's on TV. We saw that from the beginning, you know, that he was going to have that kind of attitude and that he would get the benefit from it. And, you know, there's some people you can tell that right away. Some people fool you. You know, like I said, I just do the installation. He's got to get the motor running. And, I've had a few folks that just weren't able to do those exercises afterward, and their outcome's not as good. It's very patient dependent. I'm only a small part in that.
Tell us about that positive attitude that you've had during this entire procedure. You just made up your mind that you're going to get well.
That's right. I want to do some things. I like fishing, and I like going out and doing things. And when you get where you can't even go to the grocery store by yourself, that's bad. I just made up my mind I wasn't going to live that way.
You've been back to the grocery store now?
Yes, sir.
How about fishing?
Been fishing yesterday.
Oh, all right, now we're getting down to the real heart. We're getting to the heart of the matter, aren't we? How many fish? How were the fish biting yesterday?
A bunch of little ones, but it was enjoyment just to get out.
It's just a tremendous experience just to be out and outside in the wide open spaces and wet that fish hook, and to know that your quality of life is greatly improved. Suppose that there are those viewing our program today, Mr. Owsley, who are considering having a knee surgery. What would you say to them?
just have a positive attitude about it and do what you want to do and just make it up in your mind. That's what you want. Because if you don't have it up in your mind, you're not going to do it. So.
Well, this has been a very interesting time for me to spend with you and spend with you also, Dr. Gruber. Any concluding words? This has been a two-part program. Our viewing audience saw Mr. Owsley in the first part of our program today prior to surgery, and this has been our post-operative procedure. Any last word, Dr. Gruber, that you'd like to share with our viewing audience before we conclude our program?
I just want to say that we do hips too. And actually, we've got a program coming up, and there's another gentleman had bilateral problems with his hips, and we're going to explore that as well. And there are other joints that we do in addition to hips and knees. I've got a partner, Dr. Cushing, does a great job on shoulder replacements. So there are other areas that we do arthroplasties.
And we have filmed the program with the gentleman who has the hip problem, and he's already had surgery, and so we're going to film the post-operative experience in a few days. So we hope that you'll take time to view that program also. Mr. Owsley, any concluding word?
Anybody out there has pain, come see Dr. Gruber.
Okay, that's a word of encouragement today for you, Dr. Gruber, and for Georgia Bone and Joint. Thank you for taking time out of your schedule to view our program today. Remember that we are here at Georgia Bone and Joint to improve your quality of life, but also remember today that you control your healthcare destiny.